we just got, I just have to say this. We just got Brian got a text from, my dad actually does a lot of my lead generation, so I get to work with my dad. But we're doing a seminar for him next week. We got leads so fast. We got 90 leads. My dad had to turn it off. Guess how much money we spent to get 90 leads?
I was going to spend $1,500.
Okay. Don't give it away yet, Brian. Brian's like, he's so excited. He's like, so funny. Now, okay, so how much did we spend to get 90? Is that what you asked?
Yeah. So $349 for 90 leads.
One day.
Yeah, and we started, it was just like, yeah. And so now what our team does is he goes through and qualifies to get like 20, 25 good people there.
Now here's what's cool about this, right? So even if he only gets 20 good leads out of that, like this is where people complain about crappy leads versus good leads or whatever. But the process is designed to do all that filtering for you, so they're not wasting your chair time. Okay, cool. So what we want to do before we start with this is that at your tables that you guys were just talking, problems that came up, we'd like to hear like one or like pick one or pick two and just share it with the room. So this is a small group to big group, by the way. It's just a framework since we're talking about speaking so much. What we did was instead of asking the room to bring up blockages, we had you guys do that first, and now we just want to throw it up and see what answers Scott has inside that mind. So I'm going to start with, Will, we'll start with you, buddy.
Boom.
I think kind of the consensus we had was lead quality.
Oh, yeah.
Yeah.
Just talked about it, yeah.
So
Yeah, absolutely. And like we filter out based on, obviously.
Yeah, what's the question though behind that?
That's a good point.
Say that again.
Like okay, so lead quality.
Yeah.
Consensus. That was what information was given. What is the question?
That defines lead quality?
No. Like what are you asking Scott right now? Just so we're all on the same page.
Like how to get better lead quality.
Boom. How do I get it? So
Yeah,
ask as much as you just bring
Understood.
Now, speak to that, sir.
Quality comes from quantity. And that's what it is. And most people, what they're doing, like if someone's like, I want 25 people there, they might turn it off at 30 leads.
Yeah.
Right? We don't do that. We get 3 times as many as we want there, and then we have a manual process of reaching out to them, let's confirm dinner, right? Do all that, but they know it's cash. They know there's no insurance. And we're asking, we're not saying those things, we're asking, is this something you want to invest your money in, right? Is this something that you want to use insurance for, right? And if they say those things like, oh, this isn't an insurance seminar, sorry, and then we just trick it down like that.
Yeah,
so,
that's a great answer.
Yeah.
Can I add on to that a
Please.
little bit? Okay, so
Yeah.
then the other thing, think about this. Like, so we had a client in the dental space, dental coaching space. He was selling like $70,000 packages. He was my first interview client, right? And when like 2 years ago, when the economy was kind of being shaky and interest rates were going up, dental implant, like I was like, this is going to affect your coaching business because dental implants, they're not going to get the financing they need, so they're going to push it off. I told like his head of revenue, I said, you got to get 4 times the amount of leads. Like just do it. It's gonna be, your cost per sale is gonna be much higher. And so it goes back then to well, how many, because that makes everyone a little nervous. Like, you mean I got to spend 4 times the amount? I don't know. Just put it in the calculator of like, okay, at this dollar amount, if we got 4 times the amount of leads, what is that actual cost? It might not be as bad as you think. You're like, well, yeah, but now we got 30 people at our luncheon, and I'm still making money spending an extra $1,000 rather than $1,500. You know what I mean?
Yeah.
So great. That's a great answer.
Yep.
The quantity.
Quantity equals, that's how you find quality.
That's right.
Yep.
That's right. Okay, what other? We'll go to Cash, your table. What was a good question that came from you, your table?
I think we were talking about the cost. Oh, sorry. The cost. We are assuming they don't have the money to pay. We talked about it a lot yesterday too.
Yeah.
Okay, okay, now let's ask a better question, right? So what are you experiencing, and what is your real question? Are you really thinking like, gosh, why do I keep attracting these cheap ass leads? Is that what you're really?
I guess-
Like that's what you're.
Well, I
thinking?
take Medicare, I do pain management, so they're already there in my office.
Hmm.
So I'm just, they're telling me they want other options, but then I'm maybe not even mentioning stem cells because I don't think they can afford it.
Right.
Yep.
Right.
Never,
Oh, Matt-
never
Matt wants to
assume.
chime in.
Right.
Cool.
Matt.
Platinum Biologics. We actually have a product. It's a Wharton's Jelly product. You can use it for joint injections. It's a $150 cost to you.
Wow.
It's better than PRP.
Yeah, yeah, absolutely. The nano PRP is awesome. But I always tell people, like, if someone's saying me that they can't afford it, I just realize I've not gone deep enough. It's like what I said before, is that when something's painful enough, you're going to find the money, right? So what we should be doing is, if they bring up cost, you got to dive back into, well, you know, what's going to happen in 12 months if you do nothing for you, for your spouse, and hopefully you've already gone through all that stuff. We're kind of like twisting the dagger a little bit, right? And just getting their real why. Nobody tells you their real reason of why they want to do something until you've dug like 5 times, I say, is minimum, right? So what did Ed just do? What's the real question, right? Most people, we don't think stuff through. And like I do it too. I'll say something and like colleague or whatever be like, what do you mean? Like, what do you mean by that? You know? And so you have to, but with people's, everything's superficial. I want to get out of pain. Okay. Well, what will that mean for you if you get out of pain? What's it stopping you from doing right now? What's going to happen if you don't change anything? How were you 3 years ago? What about 3 years from now? What are we going to be looking at? Right? You think it's going to be more expensive or less expensive to treat it? Like when they start to realize it's going to be more expensive, I can't do this, I'm not going to be able to walk. Like, but then you're digging into, let me ask you something. If I waved a magic wand, failed freshman English class. You know, if I was to wave a magic wand, 6 months from now, you do the treatment, you get better, which is actually future pacing them, and LP stuff. But you're better, you're feeling great. How do you want your life to be different? What are you struggling with now that is going to be different at that point? And they said, this. Well, what if we don't? What if you do nothing right now? Right? And so I just keep digging into, what do you really want out of life? That's what this is all about. What do you want out of life? Right? And it's like I was talking to you last night, and we were kind of talking about cost and value and all that kind of stuff. And Ed was talking about the unique thing. And it was like I was saying, if you're going to go buy a TV, and you can buy any TV on Amazon or whatever, like super cheap these days, right? But for some reason, you're in Best Buy, and you're like, I need a TV. And you go and talk with them. You're talking to people. You're looking it up on Amazon, seeing if you can get it cheaper. And they're like, hey, I just want to let you know about our service guarantee that we have. When you buy your TV, we're going to come to your house same day. We're going to unbox it. We're going to mount it for you. We're going to hook up all your AV. We'll get all your remotes working. And I'm going to sit there and I'm going to go through everything with you and show you exactly how it works. And we're going to take all the trash away when we're done. It's like same price, value, right? So how can we differentiate ourselves? Like, that's what I'm always thinking about. How can I innovate to give them more than what they get at the other place, right? And so I think with that, when you're stacking value, right, on what they get, when you're digging into why they really have the problem, and that's the hardest part for most people. I spend 50% of my consult just talking about why they want to get out of pain. I'm just trying to find pain and dig. It's not medical, it's not anything. It's having a conversation and figuring out what they're there for. I want them to say to me, I'm not going to be able to walk, right? Dan Kennedy always said, like, when you go to a chiropractic report of findings, you should feel like if you don't sign up, your spine's going to fall out of your back, right? Like, people only buy when there's pain. If they're not doing it, you have not dug deep enough. And then you have to say, I got to dig deeper, and
Yeah. Yeah, I think there's a couple things. Like, number one, you don't have enough quantity lead flow coming through your clinic for you to actually make a accurate assessment of that. Your current profit center, the way it's structured now with Medicare patients, is forcing you to try and squeeze water out of a rock. Does that make sense? And so, while Scott's totally accurate on all that, and I would totally agree with him, my next question to you is, what battle do you want to be in? Like, I think leaving, like right now, you should make the decision, like, okay, we have this side of our clinic that has all these Medicare patients, which, by the way, I would just do good, better, best option, and then they choose. That's very quick. Like, here's the good option, boom, it's $500, you got better, blah, blah, this Medicare covers this, here's the best, tell us which way you want to go. Like, and then you wash your hands because you're too busy helping people walk in with $10,000 treatments that went through your seminar who are super qualified. And I think that's your real, that'll solve everything for you. Because now your clinic needs to start experiencing what it's like when Mrs. Jones walks in and she just is like, yeah, I saw your presentation. This is exactly what I've been looking for. How quickly can I start? And then you're like, okay, how do we get 100 more of these people rather than trying to squeeze so hard?
yeah, if you skip the dating stage, you're trying to ask them to marry you without laying the groundwork, right? And so, yeah.
I'm a big believer too, like even with the team, like one of the things we talk about more in the boardroom, like about how to leverage your assets is like, oh, you mean you didn't go to the workshop and you didn't watch the interview, you don't know nothing? Okay, well, Dr. Scott requires you to do one of the two prior to coming in, and it's a paid consult. That changes the game because and then you pay $395, get 90 leads, 20 show up as new paid patients. Your life's just changed.
Well, it's one of the things we always tell our team, our sales guys, is that if they're not closing in the consult, you screwed something up in the presentation. Mm-hmm. Something went wrong. They should be coming in, and you should just basically be asking, was there anything that, a lot of times when people leave, a question comes up they wish they asked, and something they want to know. What's the biggest thing that you want to know from last night that you didn't get last night? All we're trying to do is get their biggest
One
objection.
or one question.
I want that huge objection,
So
and I
good.
can spend time on that objection and kill it, and then be like, whether it's good, better, best, or whatever, like, let's go.
Yeah.
But I'm still digging for the pain, right? But it should be way easier if you do the presentation right.
Whenever we get on phone calls with like potential you guys, and they're like, just tell me about your system. I'm like, did this guy watch anything? Did you watch any of the videos? Oh no, I've been busy. I'm like, well, so are we. So I'm glad you signed up for a free strategy call. How about we do this? We'll send you the link to the video, and then you can reschedule. Like, you're just, why sell when there's no context set up?
I've done that to many of you, I think.
Yeah,
Made you watch the video.
Oh, Maggie. So then,
yeah, because we want you to understand, like, it answers all the questions ahead of time,
yeah.
or most of them.
Who asked me the plate liquor? I know we're gonna come to your stuff, and then the plate liquor. Like, so just, I'd rather hear it from you than me to ask Dr. Scott. Maggie's got you. Thanks, Maggie.
So I'm in Sarasota,
Yeah.
and actually we're in a better location now, but where we were, we attracted a lot of old retired people, because that's who lives in Sarasota. And, they basically, I later learned that they're like professional seminar goers. They're going to 2 or 3 days a week for a free meal.
You've
Yep.
never seen this before, have you?
No, never, not in retirement communities at all. No, do you screen to see if they've been there before?
Well, we were using a couple different companies over the years to
Okay.
do that. They were supposed to be doing the screening.
Yeah, I have done that just to make sure people aren't, coming back. But again, like, I don't know if it's like, not an ego thing, but I think everyone else sucks and I'm going to be able to close them. Like, I think my presentation's the best. I think, the presentation should change a lot to get people I want people to come there to lick their plate and they're like, I got to sign up for this stem cell thing, right? Because they have pain and they have money and they think they're getting away with something with you, but like my job is to make it so they don't leave without finding out.
What does Stephen ask when you were confirming? Is there any pain condition specific questions we're asking?
Oh man, I haven't looked at that in a while, but I think we have chief complaint. Like, what's your chief complaint?
Yeah. So if they don't respond with it, they get
Yeah.
filtered out.
Yeah, and if they say like, I have an autoimmune disease, oh, we don't treat that. Like we have like screening stuff that he goes through to do that. But the reality is you're going to get plate lickers, right? You're not like, I don't tell people that you're going to close 100% of the room. If you're closing 50% of the room, you're doing great,
If you're
right?
doing 30%, you're doing pretty darn good.
Yeah.
The math still works in your favor.
Yeah. So are there going to be some at every dinner?
Yeah.
Probably a couple, but I don't know. I know that I'm there to get them to sign up, and that's what I'm going to do.
Another thing we do is we've got these QR codes that we make people like scan to check in. So that way when they scan that, it basically marks them as being present, and then they can never at least come back to ours. So you might get them once, but then not again. And then to kind of tie it into their dinner. So it's basically like you tell them, because some people, when we've recommended people to do this, they're like, well, people don't end up doing it. Well, you just tell them that like them scanning in is what tells the kitchen to bring out their meal, right? So everybody's going to scan to get that meal brought out, but then now they're scanned and they don't get to come back. So that's one thing that's helped a lot of our clinics.
I love it. I love it.
And like, again, so that can be a total mind block where you go in just thinking like, are these guys just a bunch of da-da-da? I've experienced this before. Like, that can be hard to get over. Like, why are there slumps in sports and in sales and everything? It's because of this. And it's because of maybe negative reinforcement that we got or whatever. Like, we need to be working on ourselves and thinking like, how did I, again, just take personal responsibility. No one signed up. I know there were some plate lickers there. There had to be some people there that had back pain, neck pain, something that I could have helped with. So, I mean, personally, I just always put it back on myself and say, I need to change something next time. I got to figure this out. And honestly, it might be our mindset walking in. There's so many guys that, I mean, slumps in sports, slumps in...
Change the clothes.
Yeah.
And then see what happens. Okay, we'll move on to that. Last question, then I'm going to let Scott show you his magical clothes. What was it?
Just asking about webinars.
Oh,
Yeah, we've done webinars. So I started doing that back in the day. I called it my 24/7 salesman because I didn't want to do that many talks, right? But I knew the talks were valuable, but it's like, how can I do this all the time? So what I did is I kind of used that more of get people to sign up for the talk, the dinner, but then retarget and send them to webinars, right? And just continually have that option out there in emails that you send out to your patients. Check out this seminar. So yeah, we did that and had them click on the link. I mean, I had people come in, watch the seminar, come in and just like lay down cash and be like, what can I get with $12,000? And it's like, who are you? But they work. Now, you'll probably get, if you have 100 people watch a webinar and you have 100 people come to your seminar, you'll do 10 times as much from that seminar. You'll do 10 times as much.
So it's not a replacement mechanism, it's a stacking
The problem with webinars is that, so I'm going to go through this, and you're going to see that everything is important. How many distractions do you have at home when you're trying to watch a video or, they watch 5 minutes while they're going to the bathroom and then go back and then they click, oh, that looks cool, I'll go in, and they've watched 5 minutes, right?
Yeah.
Yeah, people watching it on their cell phone and getting interrupted by kids. And because what I started to do is go back and look at my video analytics. People were dropping off so fast, and they were not watching the whole thing. This is a controlled environment where I can have physiology, tone, like eye contact. Nothing replaces this.
Yeah.
Nothing replaces it. So as an adjunct, I loved having webinars. I loved having the 24/7 salesman, but I wanted them in the room to get That's how you're gonna get the big results.
I'll go into this deeper, like this afternoon, just to show you the ecosystem effect of like, that I was sharing with Rob, like when we launched this one-day event, our cost per lead on our webinars dropped in half because we're running traffic to the one-day event. Then the people are seeing the invite to the webinar. And then what else did we have going? We had different retargeting happening. And then all of a sudden we'd get people, and probably some of you guys here, like, okay, I signed up for the Tampa thing, but I watched your webinar and now I want to join the boardroom. Who's Maggie? How do I get a, like, how do I give you guys, I mean, was it you guys maybe? Like, there was a couple people that said, yeah, it was you, Jeff, because you were like, oh no, I signed up there, and then I want to sign up here. And so like when you look at the ecosystem effect of it, I think it's a great, like another thing in the pocket, and with all that said, I think we're good. We're going to go.
Hey guys, we did have the question right before we braked about
we had one more?
in-office versus restaurants. I
Oh,
don't know
yeah.
if we want to answer that.
Yeah.
Yeah.
So I built everything I did at the beginning of this, and like, it was the worst environment ever. I would have them come. I had this office that was above a Chase building, and like it looked like an abandoned warehouse. But I had people come into this thing. There was no food. I had like coffee and like some snacks maybe, and killed it, right? So the dinners are going to decrease your cost per lead, okay? Because more people will sign up quicker for the dinner. So it's more expensive to get people to come to an office. But there's two advantages to that. You know they're not there for the food, and you know that they've come to your office. And that many times is a barrier for them to come into your office. Now that they've been there, it's easier for them to come back and that kind of thing. So that's a good part there. But you're going to get more people at a lower cost per lead with the dinner. And so here's the thing. That higher cost per lead, lower cost per lead with more people, and you pay for dinner, it ends up about the same. So you're going to spend more in ad spend to get them to your office, but they're probably going to be more like, I just want to hear this information. Yeah, and with a dinner, there's reciprocity. And reciprocity is a real thing. I did something for you, you want to do something for me, it's just there, right? So
Yeah.
I think overall, dinners work better. You can do an office, but it's going to be more expensive to get them there, and there's no reciprocity really. Yes?
You know anyone that's done a hybrid where, let's say you're going to do it at the office?
Cater in?
No.
Or- okay.
I did that too. They do it at the office, and then you give them a card.
Oh, like a voucher?
Go to dinner wherever you want. You don't have to sit and listen to me during your dinner. That way I have their attention in the office.
Never done that, and I've never even heard of anyone doing that. Did you do that?
No, I'm just.
Oh.
Oh, you're just making it up.
No,
Yeah.
that's great. Dude, I like that idea. You got my head turned now. That's interesting. But we'd have to look at enticement rules and stuff like that. That might be an enticement to get people to show up. And like if you're marketing that, like that, you might not want to, your board might not.
It's a dinner seminar either way.
I know, but it's all about how you say things and how you put stuff out there. And what I would worry about with that is a competitor that doesn't like you saying, this guy's enticing patients and he's going to report you to the board. That's what I worry about.
I'm a private membership association. That applies to me.
Okay. But I'm just, yeah, that's my only concern with it. Yeah, absolutely.
Cool. So Dr. Scott's going to go through the magical presentation. Let's give it up for Dr. Scot Gray again.
Woohoo! All right, so what I'm going to do, I'm going to go through the presentation. I'm not going to give it like I would give it because I've got a lot of stuff inside here telling you why I'm doing what I'm doing. We've got videos you can watch of me giving this presentation. Excuse me, so you guys can get that. So when people come in, I just have this up, and just talking to people and everything. I've tried doing like testimonials and stuff like that, and no one pays attention to it. It's kind of annoying. I'd rather have music going. And I would always do like 50s music or something that the crowd, it's all about them, right? I'm not playing music I like, I'm playing music they like, right? A lot of the music that I'm playing here, I'm using like Tony Robbins soundtrack that he does at his stuff. Like half this music I don't listen to, but it's energy, it's fun for people at events, okay? Okay, keys to the talk. I want to talk about why you, right, to the person, the problem issue, what's not working, who else is affected, and the solution opportunity. That's just kind of the move that we're going through in this. So I always do the congratulations for taking the step to come out tonight, because there's so many people in this world that are suffering with problems just like you guys, neck pain, back pain, shoulder pain, and they decided not to come out to this. They're okay with where they are. But I just want to say kudos to you guys for taking action on finding something new and finding something that may be able to change your life, right? So I'm basically saying our stuff's really good, but congratulating them, feed the ego a little bit for coming out and making the effort. So at the beginning of the talk, we're asking a lot of questions, right? We're getting the engagement going. It's key for you guys to get engagement going, raising of hands, people speaking back. If you don't do that, you won't be able to do it 20 minutes in. You won't be able to do it 30 minutes in. Do not wait on getting them engaged. Start all of it as they come in and sit down. Obviously, like you're building that. You realize how much easier it is to get people to engage if you've talked to every one of them before the seminar. Way easier, because they're your friend now. They're not sitting there trying to figure out who you are and what you're all about, okay? So that is huge. And then you're asking questions. So the questions asked, joke a little bit up front, right? Like we said, as you can tell, Ed's a lot funnier than me. Like I'm not good. Like I have to like plan jokes out because I'm not like a comedian. I'm not like that funny of a guy. But so why are we here? Did everyone click on the invite online or get the mailer, right? And everybody click on the RSVP online. Did anyone actually read the entire description? I mean, past the free dinner part, right? Everyone laughs, guys. It's all about them. I'm telling you, these are cheesy jokes that work, okay? So you know we're here to talk about pain. So I'm hey, free dinner, but you know we're here to talk about pain tonight, okay? So I like to focus on the biggies that we see regularly. Who in here has knee pain? A show of hands. Who's got knee pain? You guys don't have to do it. Oh, okay, got a few of you. How about lower back pain? Who in here has low back pain? Gotcha, wow, a lot of you, man. Okay. How about shoulder pain? And then just, I'm getting the hands raised, Go through each symptom. Then if you have specific questions about your condition, I do this so people don't talk medical in the talk and ask a bunch of scientific questions, okay? So, or questions about specific conditions. So there's this thing called HIPAA, and it's a privacy between doctors and patients. There's a lot of people in here. We don't want to talk about our personal health history and that kind of thing. So if you want to talk about that, we can talk about that stuff later on if you have like a specific question about your condition. So I'm doing this so that they are not asking those questions during the talk, okay? All right, then talk about regenerative medicines, we're here to talk about tonight. And then that's when I go through all those, have them raise their hand at each one. So after today, so I just want to kind of like lay out, what are we going through? Because they're sitting there like, what are we doing? What are we talking about today? We're going to talk about the challenging truth about the standard of care for treatment of pain, what could be causing your pain, documented dangers of drugs and surgery, proven methods for creating lasting relief, and simple steps you can take. I want to go ahead and start framing them up that you're going to make a decision at the end of this about your next step, okay? If you don't do this up front, you get to the end, it's much harder if you've not pre-framed them with this, okay? So that's why we do that. So then I talk about me. And so one of the things that I always felt, whether this was my brain just telling me this or not, but it's always worked. As a chiropractor, I always thought, hey, they're probably wondering why a chiropractor is talking about stem cell. And if that's an objection, then they're sitting there and they're thinking about it and they're not hearing anything that I'm talking about, right? So I was like, I need to nip that in the bud before I get going. And so start as a physician, focus on helping people with back pain, neck pain, headaches. And so what this is, guys, is your journey. So it's like, this is what I did, and I had this problem. I found this thing, and I was like, whoa, that's too good to be true. But what I found out was, da-da-da-da, and I changed my whole life. I sold my chiropractic practice and started regenerative medicine clinics because this is my life. I love this, right? So I give them a whole reason, but you want to tell your journey of there was a problem, you found a solution, it seemed too good to be true. Have you guys heard of feel, felt, found? You guys heard of that? It's kind of that thing of, you know, if someone says, I don't believe in stem cells. Oh, I totally understand why you feel that way. I felt that way too. And like I had colleagues tell me about stem cells all the time. I'm like, come on, right? But I started working with some MDs that were doing stem cell, and what I found out is that these patients were getting better results than people getting surgery, better results than people I was adjusting for certain things, right? So doing that and just kind of taking them through your journey. So then I tell a story that I crafted this story. I mean, it's a real thing that my wife and I, when we came down to Florida, but it's a whole story about, I always think of a concept. And the concept I wanted was when people feel underwater, something looks great and they try it and it sucks and they still feel underwater and they don't know what to do. And so this story was one of my wife and I wrote a book. I went down to Florida to do an interview on Lifetime television. And that's credibility right there too, right? You don't want to talk about your credentials, but you can sneak in credibility, right? I wrote a book, I was on Lifetime television, da-da-da-da. And we wanted to do something in Florida that we couldn't do in Ohio because we lived in Ohio at the time. And so we saw this thing for snorkeling. We're like, this is going to be awesome, right? And so I go through the whole process of, we go out, it's a stormy day. They're asking if we should be able to actually go out there and do this. And they're like, yeah, it'll be fine, it'll be fine. They ask you two questions when you go there. Can you swim? And are you afraid of fish? Right? And we're like, yes, we can swim. And no, we're not afraid of fish. Maybe sharks, if there's any sharks in the water. But outside of that, we're good. And so then we go out to the boat. And on the way out to the boat, my wife grabs my arm. And she's like, babe, I don't know if I can swim. I'm like, what? This really happened. Like, this is not a fake story. So, and usually people start laughing, right? And I'm kind of moving around. I'm not telling the story. Like, normally I have this super crafted and perfect as I go through it. I just haven't given it in a long time. And I'm like, what do you mean? Like, that's kind of important with what we're doing here, you know? And she's like, well, every time I swam, I feel like I could touch the bottom, and like I didn't really swim in many pools growing up. I'm like, okay, well, we're gonna have life jackets. Let's figure it out. I can stay close to you, or we'll figure out how to do this thing, right? So we go out there, and we get on the boat, and we start going out, and she's like, babe, do you think I would be seasick if I got seasick? I'm like, I don't know, probably not yet. Like, we're not really out there. We're kind of in the bay in Fort Lauderdale, where all the yachts are, and we're kind of moving out. And we get out there, and we start bouncing, and we're going, and she's like, what about now? Do you think I would be seasick now? And I'm like, yeah, you'd probably be seasick now. I think you're good, right? So then we finally get out there, and we drop anchor, and right when we do, like it's cloudy out, it's wavy, the boat starts doing this. The good news is, she was fine, not seasick. This guy, on the other hand, stuff started coming up right away, so I jumped up and I ran to the back of the boat. Dude got flippers on me, got me in the water. So now I'm in the water, and first one off the boat, obviously, and I'm just swimming around, doing my thing, still feeling sick. And my wife is up on the boat, and she has no clue if she can swim. So everybody else gets off the boat, and then finally she comes to the back, last person, and she gets on that little like grate that sits down in the water there so she can kind of like sit, and then she'll jump off. And like all the guys were helping us and like just making sure she can do it. And so she jumps in. Right when she jumps in, wave comes over top of her, sucks water up her snorkel. It's like spitting out water, floundering around. We get her back up on the boat. And she's like, nope, screw this, I'm done. And so she goes back up on the boat. And so our entire day, which we're thinking like, this is gonna be awesome, like do this thing in Florida, we can't do it in Ohio, go in the ocean, see fish, it's gonna be beautiful. And what happens is my wife ends up underwater, needing help, nothing like what we experienced or what we were looking forward to. And that's what most patients come to me with. I had a patient that came to me, and it was actually shortly after this, and they said this, and it's what made me think of this. They said, Dr. Scott, like I've tried this, I've tried injections, I've tried PRP, I've tried XYZ, and like, I can't get my head above water. And I'm like, yeah, I know exactly what you're talking about. And so that is my transition into, hey, does anyone else feel like that in here, right? Now I'm getting them to raise their hands and like, yes. I'm telling you, almost everyone will raise their hand after this. Like, oh my gosh, yes, I need something different. So now we're already talking about, we're changing them to something different. What you're doing is not working. They're now admitting what they're doing is not working. That's the first step. We need to get them to admit that. And if they're not engaging, they're not admitting. And so a weak presenter is going to be like, who in here feels like that? No one raises their hands and they're like, okay. And then they keep going. Like you can't. You have to get people. This is the admit stage if you guys are familiar with Sandler and all the sales stuff, right? So I decided that I needed to figure out another way to help these patients. I was sick and tired of sending my patients with severe back pain, severe knee pain, over to a surgeon. And then I had one guy, his name was Bill, and I worked with him with chiropractic, couldn't help him, ended up getting back surgery. I was walking into Kroger one day, and he saw me, and he's like, hey, Scott, Dr. Scott, how's it going? It's like, good. I was like, Bill, you okay? He's like, nope. I'm like, what's going on? He's like, I had my surgery. I'm on full disability now. I can't work anymore. I only get 60% of my salary. And his life was ruined. And I'm like, there has to be a way to save people from going through that, right? And so I just went on this journey to find the best thing possible out there. And so I looked at everything. And normally these usually come up one at a time. Like I wasn't getting this, I wasn't getting this, wasn't getting this. 2-year journey. And so what I'm putting up here now is everything else that I don't want them to buy. Everything else that they're looking at. Right? I tried PRP, I looked at PRP, I looked at ozone therapy, I looked at peptides, I looked at hyperbaric chambers, I looked at, you name it, I looked at everything. And then I started talking to all these MDs that were doing this thing called stem cells, and what we call now a tissue allograft that has stem cells in it, right? So I worked with all these gentlemen and learned about this, and what I found out is that, and everything they were telling me, I was like, an injection? Like, I'm a chiropractor, I'm used to adjusting someone 30 times, and you're just gonna go boop, and they're gonna be good? Like, I didn't believe it. I thought it was too good to be true. But then I started going down and working with them in their offices, and I was seeing the patients, I was seeing the changes, and I was seeing this, and I said, this is what I want to do. I was like, I want to be able to help people. I don't want another Bill, to go get surgery, meet another person in the parking lot that's life has been ruined by that type of treatment, right? So I never do anything for a patient that I haven't done myself. So I had to try it for myself. And as a chiropractor, I did over 100,000 adjustments in the time doing that. So I did it on my feet and hands. And what happened, like, because of my adjusting, I had really bad joints here and here. I literally couldn't pick up my girls when they were like 2 and 3. My hands were jacked. And then my feet, I had some issues with my feet with blistering and different things like that. So I did it, and in 6 weeks, I was 90% better. And like, I can literally say to this day, it's never come back. And that was 2017 when I first did it. And I decided, this is it. this is the future of medicine. I'm like, this is amazing, and I want to share it with as many people as I can, and that's why I'm talking to you guys tonight, okay? So, but here's the problem. I'm a chiropractor. Can't do it on my own, right? So what I did is I started thinking about, what do hospitals do? They have a CEO, right? They have all the business people running the hospital so it runs well, and then they find the best doctors, nurses, nurse practitioners. They get the best people there, like your Cleveland clinics, your Mayo Clinic, all that, right? So that they can give the best service. And I'm like, why don't I just do that? I'm going to go find the best doctors, best nurse practitioners, and build teams to be able to deliver this to people. And so that's what I did, okay? So now we're going to go into the what is pain slide. So that whole opening part is to get them to laugh a little bit, also to get them to admit they have pain, get them to admit what they're doing is not working, like all of those things. And we have them engaged. Now they're like, yeah, Dr. Scott, yeah. And I've told them my story of how I got here, and now they're seeing how passionate and excited I am about this, right? I did it myself. I didn't think it was going to work. This is crazy, right? And so we've done a lot on their psyche already with that, okay? Now they're more open. Now they're like, what is this stem cell thing, you know? So what is pain? We ensure the audience engagement is high, obviously, don't proceed till they are. Frame discussion, we'll talk about solutions, but first let's define pain together. Because they may be thinking like, tell me about stem cells, tell me about stem cells. So, you know, we're gonna get into the talking about stem cells and tissue allografts and all that, but I wanna dial it back a little bit and just talk about what is pain? What actually is that? So ask the question, if you were to describe pain, how would you describe it? And so I get people talking now. How would you describe pain, right? How would you describe pain? How about you? Those are all really great examples. So what I would say, so again, we're getting more chatter. Remember, I talked about callbacks and active listening. You're gonna get them talking about pain, right? And if they say, oh, it's when sharp shooting pain down my leg or like a knife-like pain. Later on, I can be like, yeah, like that knife-like pain, right? Or that sharp shooting pain. Those little things, guys, add up. That active listening is huge. So what is pain? How do we handle it? This is the slide we have when I ask that question. Let's say, look, it's super simple. My definition is, and you see this anywhere, signal to our brain that something's wrong, broken, or not working correctly, right? So then we kind of talk about opioids, how we cover it up, that we take 90% of the opioids in the world and we're, whatever, 5% of the world's population, et cetera. We go through all that, that's a problem. We talk about, obviously, like, don't ignore the warning signs, the high pill consumption, poor outcomes. One of the things I used to say in my talks was, who in here wants to take another medication? Right? The good news is you're in the right place, because we're not going to talk about that. We're going to talk about, what if you could reduce your medications? How good would that be, right? Let's talk about it. So I just open that thought in their head. I don't tell them I'm going to do anything. I'm just opening that thought as we go through. So we're going to evaluate past treatments. We'll get into that in a second, and realize the current path is broken as we go through this. So I came up with this in 2018. I call it the glide path to surgery. And so everyone in pain is on the glide path to surgery. What do we mean by that? What do you first do when you have pain? Right, and I'm getting engagement, this, that, okay, even before that, probably ignore it, right? It's not bad enough, it's gonna go away in a week, it'll be fine. And that, usually guys were worse than that than the ladies are, but that's a first step. Next thing is manage it. And how do we manage pain? What are some examples of how we manage pain? And everyone's gonna say pills, shots, that kind of thing, okay? So what we're doing is setting everything up of how the system works, because we're about to tear down that the system sucks. So we're going through all of this, so that they're talking about what they do with their doctor, right? Because what they need to know is that I know what they're going through. They have to know that I know what they're dealing with, what they've been through, because that's a trust and that's a way that we can connect. And then what's the next thing? Joint replacement, right? We see that surgery, expensive, there's risks with it. Sometimes we'll even talk about who in here's had a hip replaced or a knee replaced. I'll get someone, if someone's there that has that, say, let me ask you something. How long ago did you get your knee replaced? And they'll say, how's the other knee doing since you got that one replaced? Like, oh, it's starting to, almost every time. They might say it's fine. Oh, that's great. Because what normally happens with most people when they get one knee done, what happens to the other one? Starts going too, right? And nobody wants that, right? So how do we fix it in the beginning, right? So then there's additional joint issues. Oh, that's where I go into it. That's where I go into the, you fix this with surgery, everything else goes out, right? So we go through the glide path to surgery. This is how we treat pain in America, right? Has anyone done anything different with their medical doctor, right? And most people there have not. That's why they're at this talk. So then we go through the dealing with pain. We just went through that. That was supposed to be before that. So cortisone. And I have to update this. But FDA says something to the effect of like you should never get more than 2 cortisone shots in any joint.
3.
Is it 3? Okay.
3 in a lifetime.
In a lifetime.
Male bonus of them too.
Like, bring that up, guys. Bring that up when you talk about cortisone and shots, right? Like, what? Nobody's ever heard that before. FDA approved, but they tell you don't do it. So then I go into the cost of surgery, and one of the things that a lot of people say, I'll just do surgery because my insurance covers it. I understand that, and like we're told that a lot of times, but what I've found is that, if you look at it, you have all these different hidden costs, the surgical center, second surgery. 1 to 3 patients need a second surgery within 5 years, right? And then you're into that cost again, right? Another deductible, medical device fees, significant out-of-pocket costs. And so with a $75,000, $100,000 surgery, most people are spending $10,000 plus on their own to do that. And then whatever, if there's any complications after, it's even more, right? So unfortunately, surgery has gotten more expensive the further we've gone. So, story about someone getting surgery. This is something that you can come up with and bring in a story because facts tell, stories sell, right? So your story is going to go a lot further than you just saying surgery sucks, right? But do you guys know someone that had an accident, hurt their knee, whatever, changed everything? Maybe they were an athlete and they had this trajectory of doing something great, or someone that you know in your life that had a surgery and it totally changed the course of their life. If you have a story like that, this is a great place to insert it. And you talk about they were going to be the next LeBron James and da-da-da. It doesn't have to be that. But, do some they said, what? We'll do some rehab, see what happens. You'll need a total knee replacement, but you're not old enough yet, especially with a young person. And it's like, why do they say that? What qualifies someone as being old enough? Like, what does that even mean? Well, they know that a total knee replacement lifespan is 10 to 20 years. They want to manage pain, but they don't want to do it too early because that might be 2 or 3 total knee replacements, and they're going to wait, so they only have to pay for 1 later on in life, right? So, because these decisions are typically not made by us, right? And a lot of times the medical doctor tries to get stuff approved, but they can't because, who's really making the decision? Well, insurance. Right, and that's not really healthcare. So someone says something like this, because you'll get someone like, my knee replaced in 1985 and I'm doing awesome. And it's like, sweet. Back surgeries, total knee replacements, they're really not pain relief procedures. And the good news, I love that you're doing great. I would say probably most people haven't had that experience, but these are really just to keep you mobile. These are not that you're not going to have pain again, right? Like our goal is really helping people to get function, mobility back, to decrease that pain so it functions normal, where these are more of, stop you from being paralyzed so you can get around. Most people have pain afterwards, and they're very upfront with you about that with surgery, right? And so if you've had one done, there's a 30 to 45% chance of eventually needing the other one done, and that is an exact stat. So why do you think that would be? We know not all surgeries are perfect. That's why we love to empower people to make decisions best for you. So I just wanted to put that in there because you're going to get weird things like that. But just know, like, oh, I understand. Like, I love that you're doing great. Unfortunately, in the amount of patients that we talk to and see, that's not normally the case. And so we just try to find, I would guess most people in here, you guys want to avoid surgery. Who in here wants to avoid surgery? Yeah, okay. So what I want to do is show you what you can do to not do that, right? Does that make sense? And so like get them back on your side of like, yeah, like I don't care about a surgery, like talk about something else. And then I say, and there's a problem, this whole system is backwards. Insurance company is telling us what to do and how to treat these problems, and they're taking us down the glide path to surgery, right? Just managing and letting it get worse and worse. Let me ask you, so this is a burner here, and when I was younger, I was an idiot, and I went to a summer camp up at Beulah Beach, it was called, in Lake Erie in Ohio, and we would go there every year. And I go there, and we're getting ready, the family's there, and it's breakfast time one morning, and my mom was making food and everything, and I saw the cereal up in a cupboard. So I decided to go jump and get the cereal. So I ran, and I jumped up to get the cereal, and put my hand right on a burner that she had just taken the eggs off of, and literally just melted my hand, right? So it made for a really bad week at camp, and not a very fun experience. But the reason I tell you that is now I've got 2 young girls, and my favorite thing to do, like Dad gets the weekend time with the girls, and so I love making breakfast. We'll do eggs, bacon, Mickey waffles, all that fun stuff. And when I do that, I freak out because I'm like, I hope they're not as dumb as their dad is, but just in case, like if they got their hand on the burner, I'm just so nervous about it. But I'm going to ask you a question, and I want you to judge me as a dad when I tell you this, okay? So if one of my girls, God forbid, got her hand on the burner, and what's she going to do, first of all? What's her reaction going to be? Scream, right? Pull it away. But what if I said, sweetie, when something causes pain, you can take this medication, you won't even feel it. Remember that pain signal? I can literally block that from going to the brain. Just leave your hand there, right? And if it gets really bad, we can do cortisone, and then we could do opiates. I mean, we could do all kinds of good stuff that would block that signal. And then when it gets bad enough, the skin graft, and we'll just fix it. So, good dad, would you guys do that with your kids? Why do we do this with our joints, with our back? This is exactly what we're doing. We're leaving our hand on the burner, and we're just taking pain meds, shooting it up, doing everything. Well, the problem's still there. Did anyone solve the problem? We are sitting there with our hand on the burner and just doing all this stuff. Why do I call it the glide path to surgery? Eventually going to have to do. Going to have to do surgery, right? Why do we treat our pain this way? Does it make any sense? And so this story right here, guys, is my way of getting them to say, all of that is horrible and stupid. And it's a true story about what I did with my hand and about my daughters and breakfast. Like that's all true stuff. But I love the fact that, it's a little bit more emotional that you're leaving a child's hand on a burner. It's kind of like you horrible human being. But then you have to say, this is horrible what I'm doing to myself. This is the whole story that changes their paradigm. And now they're like, holy crap, like what am I doing? So now, I put this up, what should I do? Like, was that a good way to do it? Like, no. What should we do? We should fix it. Let's get our hand off the burner and then address it and help it heal. Would that be a better solution for that, right? Who in here wants to get their hand off the burner and actually fix their problem? You guys want to learn about how to do that? We're going to jump into it right now. So now we're going into stem cells, right? So that story is emotional. It changes everything. Now they're in the mood to be like, tell me what this is, right? So I always like to get people on my side, right? So what I'll say is, who in here believes that the power that made the body is the power that can heal the body? By show of hands. Everybody raises their hands. Everybody does. Excellent. Well, I want to tell you, you're in the right place at the right time today, because that's what we're going to talk about. So again, what do people need to know? Why you're there, and that they're in the right place, and they're learning the right information for what they're looking for, because they want to get their hand off the burner. Okay? So then we go into basically talk about cells and how cells grow and divide and the body regenerates and all that. We talk about how, we double in size by 5 months, we triple in size by 12 months, we quadruple in size by 24. Like, isn't our body amazing? And how it can grow and grow new cells and do all this, right? So then I read this thing, by the time I'm done doing this, 50 million of your cells will have died and been replaced. And so they're just starting to understand biology a little bit of what this is, okay? And that's kind of a fun thing. It's not necessarily, research, so to speak, right? Keep it fun. And here's the thing. Our body's always breaking down, right? When we were younger, we could go out, play basketball all day, go home, drink soda and eat pizza all night, stay up till 2 a.m., get up the next day, do it all over again and feel awesome, right? But today, I sit up wrong in my bed and my back hurts for 3 weeks. Like, what is going on? Well, the thing is, our body's always breaking down over time, and your body's always trying to fix it, but it's slowing as we age. Why is this happening? Why are we able to heal so quick then, and now it's lower? Well, if we look at mesenchymal stem cells, which the treatment that we're talking about today is an umbilical tissue allograft. What is that? The umbilical cord? It's loaded with stem cells. It's the most highly dense tissue in the body with stem cells. And so just to be clear, guys, I don't say stem cell therapy anymore. I talk about umbilical tissue and the fact that it has stem cells, that it has cytokines, that it has growth factors. I don't say we're going to give you stem cell therapy. The FDA will not be your friend if you say that. FDA is not caring about what you do, they're caring about what you're saying. And they hate the word stem cell therapy, okay? So wipe it from anything that you're doing. And you'll see it in our talks, it's all umbilical cord tissue. We're gonna talk about stem cells, but what we talk about is the fact that they are in the treatment that we give you. We're not giving you stem cell therapy, we're giving you a tissue umbilical. It took me a lot of lawyers to figure this out, by the way. But this has been approved by multiple lawyers now on how we say this. So obviously you guys know this. We go through the amount of stem cells that we have. So going over stem cell research, which is gonna be the next part. We started putting stem cell research in there, but a lot of people want to just like sit there and go through all the research and go into like, look at what they're doing in this study and that. We're not doing that. All we're doing is we're showing that it's not new. Studies have been done for years. There's thousands of them. We're not saying that we're doing these things because some of these are about like regrowing hearts and getting people out of paralyzation. There's a ton of research and it's growing. We're showing top athletes are doing it, right? Like, oh, Tiger does it, Jack Nicklaus does it, Peyton Manning did it. Like, it just gives it credibility, right? Show it's in the news everywhere, the new wave of medicine. We anchor price here. We actually say, Tiger Woods even did this for his back issues, right? Actually made it so he could come back and do the Masters again, right? When he came back and won the Masters back in 2018 or 2019, whatever that was, which he actually just said he might do the Masters this year. But anyway, we drop it and we say, he spent $90,000 to go get that done. That's how important it was for him. Then we just keep going. Because I want them thinking, $90,000? Holy crap, this is expensive, right? So I just leave that out there. I'll just leave the $90,000 out there and let them think about that. Sports Illustrated in 2014 said hundreds of NFL players use stem cell, for injuries. So it's just like, this is all just credibility stuff. So when I go through this, there's a ton of research now. You can see Australia, they're showing that, it's improving quality of life. There's one here that we see where stem cells offer promise as a new medical treatment, blah, 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 blah. And as you guys can tell, I don't give a lot of talks anymore. So I would have this like totally scripted and better, but like know exactly what each study's about, because I just want to go through. They're even doing it for heart disease. They're even regrowing new hearts, skeletal regeneration, all kinds of cool stuff that they're doing with joint repair, right? There's so many studies. There's thousands of studies on this. This stuff has been studied since the 50s, right? And even before that. So stem cell, it's not new. It's been around for a long time. And you can see all the top athletes. Peyton Manning, for his neck injury, I think he went over to Germany to get his done. Jack Nicklaus, very vocal about stem cells and how good they are and how great they are. And Tiger, made it so he could do da-da. And I heard he actually spent like $90,000 to get stem cells done to get him back to golfing again. But what I want to go into now is that when you get this tissue treatment done, it's very important where it comes from, right? Because there are places that I think are, not locations, but sources that I believe are unethical, and ones that I believe are ethical, and there's ones that I believe are more safe than others and easier to do, right? So if we look at this, fetal and embryonic, you guys hear about the ones that got banned? The government banned them. I think it was back when Obama, was it Bush? Bush banned it. So we can't do that in the US. We don't do that in the US. Even if we could, I wouldn't do it, right? So and this is one of the things where, depending on where you are in the country, your audience may have different views on things, right? I would think New Jersey folk may be different than Florida, than Texas, than California, but especially in your Texas, your Midwest, all that, I make it a point to say, even if this was legal, I wouldn't touch it. And they're like, yeah, right? Like, that's an important thing to say. And then there's autologous, right? That's using your own stem cells, or adipose, which is fat, right? And the reason that most people don't like to do that is because it's actually a surgical procedure. And so they'll have to open the hip up, go down in the hip, pull out the bone marrow, spin it, get the stem cells. And honestly, for young people, it's probably really good, right? Your young folks, your teenagers, because they have a ton of, remember how many stem cells we have as we age? When you're younger, you have a lot of stem cells in there that you can use. But as you get older, you have less and less, so why wouldn't I go to a source that has way more stem cells, way more growth factors, way more cytokines, right? And so that's why we use umbilical cord tissue. And so inside of umbilical cord tissue, there's the mesenchymal stem cells. There's these things called cytokines and exosomes, growth factors. So this is way more than stem cell. This is beyond stem cell. The umbilical cord tissue has a lot of amazing parts to it. So this is donated by Live Healthy Births, Mother's Screen, talk about the safety and efficacy. Umbilical cord tissue, we talk about the human leukocyte antigen, no immune response. Day zero cells is a big thing that we say. I'm 46, I could use 46-year-old stem cells, or I could use day zero stem cells. I'm gonna pick the day zero stem cells. I'd rather have those than my depleted amount, right? So, and then we just go down through all those things. And again, I'm just kind of flying through this stuff, okay? And then to get more credibility, we go into Dr. Reardon. We just do a quick video of his. And, since we do so many seminars, word gets out about us. And so Reardon reached out to us at one point to tell us to stop doing certain things. I would give people one of his books if they signed up for a consult to take home and read before their consult. He didn't like me giving his books away. So we changed that. But the reason I say that is, where do I have, here. We don't work with him. Like, I show this video, but I'm very clear when I talk about it that, he's great. He's the godfather of stem cells. I watch everything this guy does. I love his research. And then we talk about his textbook. We kind of joke about it. Like, anyone here have trouble sleeping? I can help fix that for you. This book right here is a textbook of pretty much all research on mesenchymal stem cells. Read that for about 3 seconds, problem solved. You guys are good to go, right? You're asleep. So, but then I say you can get his other one on Amazon, but watch this video on Reardon. So I'm saying that while this picture's up there. He's the godfather. We don't work with them. We don't do what he does. He does different stuff than us, okay? He focuses a lot on autoimmune diseases and different things like that. So amazing things that he does. This is his other book, and then let's watch this video with Dr. Reardon. And, I don't have that turned up. I still have music on. Anyway, you guys will get that video. And this is just him lining up everything that we talk about. Like, everything we just said, he's reiterating all of it right now, okay? And he talked about all of this. Now, one of the things my attorney was really crazy about was these are obviously claims right here. So these are specific to each claim right there, this research. So just like Dr. Reardon says, what do mesenchymal stem cells do? They control inflammation, modulate the immune system, stimulate regeneration. Aging and degeneration, many chronic diseases due to a lack of dysfunction of mesenchymal stem cells, just like Dr. Reardon said. Again, I've got the research down here for these, where these things come from. As we age, the number and function of our mesenchymal stem cells decline, like we saw earlier. Actually, that's an old slide. But anyway, from there, we're just going into frequently asked questions. We've done this a lot. We educate a lot of people all over the place with this, and we kind of know what all the questions are that you guys have. So I want to run through a few of those right now and just make sure you get all your questions answered before we head out tonight. So we talk about what does it look like, just the needle, and it's just in the microscope, it looks like this. Distribution center, what the product looks like, how it comes. It comes in this thing. We tell them it comes frozen, it's stored at -80 degrees, and when it comes, you get to hold it in your hand and actually defrost it yourself, and it becomes able to be injected in, and then you give it back to the NP, and then they'll inject it right there for you. It's super quick and easy, easier than a cortisone shot. How long will it take to feel better? Each patient varies, typically 4 to 6 weeks, but they're not immediate. Most results will take a little longer. This is a regenerative process. I had a patient, this is a true story, that 6 months after they got the treatment, they called us. They're like, I woke up, I have no pain. Like, it's totally gone. Zero, nothing. And she was good. And it's like, and actually John Young was my first mentor in this, medical doctor down here. He told me, he's like, if it hasn't been 6 months, don't tell me it hasn't worked. Because obviously we know the cells are going in and they're turning on our cells. They're really signaling, right? They're getting everything cranking again. So then it's going to take time for it to continue to work and do its thing. So that's what we do there. Are there any side effects? Some patients have normal discomfort associated with an injection. Very rarely people have what's called a healing crisis. What is that? Have you ever had something where you get a little bit worse before you get better? Sometimes people, when the healing starts, they'll get more aching, a little bit more pain, but it goes away typically within like 24 hours and you feel awesome, right? But that's very few and far between, but it is a possibility. How many treatments will I need? The goal is one treatment, right? For severe conditions and degeneration, some patients will like to have multiple treatments. Can you treat disease? No, we do not diagnose or treat any disease. And so I put this stuff in here because I want to be able to be happy and okay if the FDA watches my presentation. And that I am super clear, we are not treating any kind of disease. Root issues with many age-related, decline in pain is just like we talked about, right? There's inflammation, right? What's arthritis? Arthroitis, it's joint inflammation. That's why people have pain. So if we can fix that, what goes away? Right? So we want to modulate the immune system. We want to work on degeneration. So these are the problems we have, and the beautiful thing with umbilical cord tissue, those are all the things that stem cells, exosomes, cytokines, and all those things do, okay? So how long does the treatment take? Treatment takes just 10 to 20 minutes, similar to any injection you've received in the past. Consultation and prep based on each individual needs. No downtime. Is it covered by insurance? Unfortunately, insurance only covers things that go through the pharmaceutical model. Drugs, repeat procedures, short-term solutions. Kind of like what we talked about. The glide path to surgery, right? I mean, that glide path to surgery is the insurance model, right? That's what that is. So all the things that have to have you keep, oh, there's glide path to surgery, okay. And one of the things that I say is, typically, when something is covered by insurance, it's covering up your problem. If it's covered by insurance, it covers up problems in most cases. So this is an opportunity to get off that path, take the road less traveled, one of healing. How much does it cost? Very low cost of surgery, rehab, pills, time, pain, opportunities lost. Typically starts at $5,500. It can go up with as much as you want to do, however much you want to do in your body. So financing and discounts available? Yes, both financing and discounts are available. We're focused on efficiency, volume to pass on our savings to our patients. What's the FDA stance on, I fly through price. I fly through financing. I'm not sitting, the more you talk about price, the more awkward and uncomfortable you're going to make it like it's a big deal. It's not a big deal. They know it's not covered by insurance before they came. They know it's a large investment. Say the price, move. Say the price, financing, move. What's the FDA stance on stem cells? Like all other natural treatments, it's not FDA approved, right? This is not an FDA approved thing. The tissue banks and everything, they're the ones who the FDA looks over to make sure they're doing things clean. Think of if someone donates a kidney, it's going to have to go through all the screening processes to make sure that it's good before it goes to that patient who's going to receive that kidney. They do the same thing with stem cell. It has to go into quarantine, make sure there's nothing bad in it, make sure it's sterile and good. So what are the advantages of these stem cells? Anyone can be treated because there's not an immune response. Optimum potential to control inflammation, modulate the immune system, and stimulate regeneration. How much research is out there? Over 4,000 studies. Umbilical, over 30 years. That's probably like 80 years now, honestly. But you can go to these websites if you want to get more research, right? Just look up stem cells and you're going to find thousands and thousands of articles. So could they grow into something else? And I put it in there because people ask it a lot. So no, cells can only be used for what's called homologous function. What does that mean? Just the same thing that it was used for, structure and support, in the umbilical cord. It's going to go in and be structure and support in the joint and the area we put it so that it's not going to change or do anything like that. So cushion support viscosity. But with that, a lot of times I'll say the ones that do grow into something else, that's those fetal and embryonic ones that were banned. Those ones are not differentiated, so you could put those in and you could end up with a third arm coming out here or something. You never know what's going to happen with that. So what's next? Who should come see us? If you're suffering from any of the things, if you raise your hand for any of those things, and so I'll go through each one, and we already got them to admit. We already got them to raise their hand, so they're sitting there like, okay. Your simple next steps: reserve your spot, get your qualification consultation. We'll perform an evaluation, screen orthopedic and neurologic exam, give you a recommended action plan that's custom fitted to you on exactly what you need based on your symptoms and your evaluation. I'm big on them bringing the spouse, really big on them bringing on the spouse. So I made it in my offices where they had to. And you just, look, this is so important. And you know what? Sometimes they zoomed in from work, or they even got on a 3-way phone call. But you need them there in some capacity, because the I need to talk to my spouse thing, nothing made me angrier than that phrase. And I'm just like, okay, no more. Like, they got to be there, okay? So pre-screening consultation. So we go through all this stuff. It's $249. Because you're here today, it's $89. But if you're able to schedule in just this week, it's $29. And so one of the things I would do at the end is, as I drop it down, usually it's the next 48 hours, next 2 days, is that's when I want to schedule people in the next 48 hours every time. Don't say this week, say 48 hours, okay, next 2 days. We cleared the schedule, and I cleared out, and I would look at my schedule and see how many spots I have, and then I would look at how many people are in the room, right? Let's say there's 25 people in the room. I would say I've got 17 spots. So people know if they don't raise their hand, like, they're going to get left out at the $29. And you guys ever gone around? Has anyone ever done this kind of a model before? Have you ever gone around and they're like, hey, can I really can't do it this week. Can I just do it next week? Yeah, you absolutely can. It's just going to be the 89 instead. Right? Oh, hold on. Let me look at my calendar. Yeah, look at your calendar. All right. So, but that's an objection that you're going to get. So just be prepared to say, absolutely, you can do the 89 next week, and I can go ahead and schedule that for you right now, and we can just charge the 89. And they're like, oh, what do you have on the 29? So why wouldn't you, right? Who should not come in for an evaluation? The thing about this treatment is it's not for everyone. 1 in about every 10 people that we screen is disqualified from even being able to get care, because there are some things that just rule people out of being able to do this, or it's not the right issue, okay? So don't come see us if you're not that serious about getting better, right? Like I said, we've got 17 appointments available, and there's people in this room right now that really want to fix their problem and really need to get in and see us. So please don't take up a spot that someone else could get on the calendar. And the reality is we take this very seriously, and we only want people that are super serious about their problem, their issue, and are ready to get some results and a change right now. People that just say, I'm sick and tired of this, I'm getting my hand off the burner. That's who we want to come into the office. And if you just came for the dinner, we're super happy you came out. So thank you for coming out. Please do not schedule. If you're feeling guilty because you had dinner, like, enjoy your dinner. I'm glad you're here and you got this information, but please do not sign up if you're not serious about it. Did everyone promise that for me? Great, thank you. Okay, so, and then this is kind of like this is a weird picture that AI did and kind of creepy, but, so we'll do the close here in a second and go over that, but as you can see, I just kind of go through this stuff, and I'm all leading up to the close, because now they have this, now we've done the offer, you have to get them emotional then and start to challenge them after you've done this. Now we're going to get them excited about coming in with the close. That's where you can change. That's like when I used to do that without the close, they're just sitting there staring at you. And if you have a form in front of them, they're like, is anyone else? Anyone else signing up? You know, like, I don't want to be the first one to sign up, you know? So the close changes that. When you start doing the close, all of a sudden pens start getting picked up, people start writing, and then it becomes, you know, starts to spread around the room. So once you're done, though, with the close, when I'm done, I leave the front and just, you know, hey, oh man, this smells good. This is torture walking around here, you know? Hey, do you have any other questions? You know, I'm hanging out with them now, right? And I'm just there while they're signing up with the person that's coming around and doing that. So, yeah, don't stay up front. Just go around, join the conversation, repeat questions loudly. I don't know if you guys know this. We talked about webinars, right? Do you know when most sales are made on webinars? Q&A after the webinar. The people who do webinars and then stay on for an hour and do Q&A, that's where all the sales happen. Because someone has an objection, right? So I'm doing my Q&A, making sure that there's no objections left, that they're signing up, okay? So that's who I become. I become the Q&A at the end to make sure that they're, whatever objection it is, that we're getting that. Brian reminded me of something that I used to do that everyone thinks that when you go to a doctor's office, you're going to sit in there forever. It's going to be 2 hours, that kind of thing. So what I always do is say, and I want to let you guys know, when you sign up, let's say you sign up for 3 o'clock tomorrow, we have what's called a no-wait policy in our office. You guys ever heard of a no-wait policy at a doctor's office before? Probably not, right? When you come in, we're actually going to give you your paperwork tonight to fill out. When you come in, we're going to take you to the room. You're going to see the doctor right away, okay? And then you're going to be in the office for a half an hour, 45 minutes. So you upfront them on that. Yes, Will.
Quick question.
Yeah.
Is there a proper way to go around to have like your CA ask if they want to get scheduled?
So what we did, my last office that I did this with, Alex, she was awesome. She would just walk around and be like, hey, we've got tomorrow and the next day available. Which day did you want? Yeah, just which day did you want? Yeah, and one thing I did do for a while that's worked, again, I just haven't done any in a while, but I would have folders and say, I've got 17 folders. Please raise your hand if you want a $29 appointment. Okay. And when they're gone, right? And you have enough there for your appointments that you have. So I did that. That worked really well to get people raising their hand and doing that. But if there's folders left over, that's when I'm going into my close and say, look, I like to end all my talks. I give so many of these talks, and I just love to finish it with a quote from one of my favorite books. It's a classic book, As a Man Thinketh by James Allen, where he says, men are anxious to improve their circumstances, but they're unwilling to improve themselves. They therefore remain bound. And that describes most people, right? You probably know people that complain about their aches and pains and, but they never look for anything new. They're doing the same thing over and over, and they just continue to complain. And what's the old adage, the definition of insanity? Doing the same thing over and over. And that's what happens every time. And I do that every time. I pull engagement with that because someone is going to know that, okay? Yes, expecting a different result. Shoot, I got lost there for a second. And I'll tell you that this treatment that we've done has helped hundreds of our patients and millions of people around the world. Now, if you are thoroughly and completely happy with your health right now, how medicine serves you, how the glide path to surgery serves you, you wake up every day and you feel great. Please, ignore everything we talked about tonight. Like, this isn't for you, and that's totally fine, right? So, but I would wonder why you came out and left your home to come out and listen to this guy talk tonight and stay the whole time. Obviously, there's probably some part of your health that you want to change, right? And I would just urge you not to come all the way up to this opportunity and this point of decision only to turn your back on that opportunity. So take the chance tonight, take the opportunity tonight, come in, see if you can get qualified, and we'll find out if we can help you. I'll just tell you, this is the pinnacle of what I've been able to do. I kind of told you my journey. I love this so much. I love being up here talking to you about this, and I'm so excited to see if we're going to be able to help you get your hand off the burner and use the power that made the body to heal your body. Sound good? Great. Thank you so much, everyone. So I missed a few lines in there. I haven't looked at it in a while, but you guys, we'll get you the close with every single line in it. But so what I'm doing there is I'm referencing something that is a classic book, right? Just a credential type thing, but it's a great line, right? You want things to change, but that's another thing I say in there. Things don't change unless we change things, right? Nothing's going to change. And one of the things that I do is I say, you probably know people like this. I'm not saying it's them. I'm saying you probably know people like this that complain about their aches, their pains, and they never try anything new, never get any results, and everything just stays the same. What's that old adage? And we do that. We talk about, stem cell, and then I'm like seeing the script in my head. So, what's that?
The pinnacle of my practice.
Yeah, so at the end, I'll do the pinnacle of my practice and my calling and what I do, and just sharing your excitement about it. And so I do a callback. We did the power that made the body is the power that heals the body. Everyone said they believed in it. So I say, if you believe that the power that made the body is the power that can heal the body, you're in the right place at the right time. And we look forward to seeing you in the office. I thank you all so much for coming out tonight. Your attention, your questions have been wonderful. Have a great night, guys. And then clap, clap, clap. Sign them up. So that changed, and like I said, I stole that from Dan Kennedy. It's not like I just took it and did it verbatim and just changed sales stuff to healthcare stuff. And I went from closing 30% of the room to 60% of the room. And works, doesn't it? It does. Yep. Yes, Rob.
You've done a really good job price anchoring the 5,500 minimum.
Mm-hmm.
You basically financially qualified everyone who was going to raise their hand to sign up. Why are you still sticking with 29?
Actually, I encourage most people, and they know 49. 49 is actually what we do.
Yeah.
So, yeah, it's just an old presentation. And I actually used to do, for the consult, and I actually used to do, it's a $40 charge to come in. And we use our seminars as a fundraiser for Make-A-Wish Foundation. So we're actually donating that money to Make-A-Wish Foundation. And so then I actually do a risk reversal and say, so the worst thing that you're risking tonight is giving $40, $49 to a great organization to help kids. That's all you're risking, Will.
Have you ever, just asking, have you ever raised the initial price, say 500, and then say you credit that towards their treatment?
We used to do a thing, I might have it in my bag. If you signed up tonight, you get a $500 credit to your account, and we had a little card that we would give them. It's a $500 credit if they signed up that night. But I'm telling you, you do this, you're not going to need to give them a $500 credit. Yeah. So, I mean, and it's just kind of like if that's what it takes to get them in there, it might be the right person, might not, but.
What percentage of the people you see in a review of findings remain unqualified, just that 29 was too damn good to pass that?
Wait, oh, you're saying, because it's so cheap that everybody comes in and, we've had plenty, man. Like, I'm not saying that 100% of the people that are coming in your office are gonna be like, let's go. Like, I still think you're probably gonna be at like 50% close rate in the office. That's still a good close rate to have. So, yes, we get denials. And just like Ed was saying, Care Credit, not as good as it used to be. All the financing companies are a mess, right?
What's the top one right now?
We've loved Repeat MD. Here's why. They have given us more money than Care Credit for the same person. It's a flat monthly fee. Care Credit's like 18% fee on some people. It's insane, right? Repeat MD is 0 or 1 or 2%. Like it's something tiny.
It's like 2%,
Yeah.
and then it's like $349 a month, $379.
Why wouldn't you just use a firm through Stripe or something?
Well, Repeat MD is a firm, basically.
There's another one called InstaPatient, does the same thing. 3% uses a firm.
What is it called?
InstaPatient.
That's who we use.
You like them?
Yeah, that's same as PMD.
Yeah. It's a firm. It's like a firm is other brands are coming in and using a firm. Yeah. So What were you saying, Will?
Care credit goes down to $590 now.
Really? Holy cow. So,
It's more debt to income, and you have to have them do it from their phone, because if you do it on your IP, it flags it as.
okay, thank you. Never, ever, ever do someone's financing for them, ever. People have gotten busted for that, like abusing the elderly law by filling out financing for them. It's like they didn't know what they were doing. They take you to court, you lose if you filled out their financing forms. So they've got to do it all, and if they can't do it, send it to their child or something through email or, you know, their son or daughter. So yeah, don't fill out people's financing stuff. Thank you for bringing that up. That is a huge no-no.
Everyone is united, but their processing fees are horrible.
Yeah.
The subprime is 33%.
So here's what I would recommend. Set all your prices at the maximum level that you're willing to take with, like, let's say your highest is 18% with care credit. Make your price up so that 18% brings you down to where you want to be. And then that way you can give them a cash discount if they pay with cash, check, credit card, whatever. So set your fees where that care credit thing doesn't mess with you. Yeah, doesn't change what you take home. Got to keep those margins. Brian, were you asking a question earlier?
No, I was just gonna make the comment that, you know, I've done it $20, $29, $49.
It won't make a difference. It will not make a difference.
Get a commitment, and even if it's a little commitment, they'll show up. But if you just say it's a free consult, don't do anything, it doesn't seem to work as good.
Yep, and then you want them giving you money before they come in the office, and it changes that relationship. So I know it kind of flew through that. I've got better versions of that where I'm more scripted and on point, where you can actually see me doing it. But the biggest things in this, guys, is like that beginning part, just kind of helping them understand who you are, getting them engaged, getting them to admit to their problems, and then getting them to flip on the glide path to surgery and flip over to, I need something different, and then challenge them at the end with the close, saying, losers keep doing the same thing and they stay in pain. Those idiots. Who here wants to be an idiot, right? So you're not really saying that, you're just challenging them, and people need challenge. Everyone takes the path of least resistance. Everybody takes, well, what's the easiest thing? I'm not gonna make a decision tonight, I'll think about it, I'll call them later. I can pay $89 instead of $29, I don't care, I'm not gonna sign up tonight. Like we gotta think about what's going through their heads, right? And it's the next 2 days, this amount, and we wanna get you in quick, find out if it, and then the close just takes them through a, like, I need to do something. I can't wait any longer, right? So I'm telling you guys, if you're just doing the offer of $49 or whatever you're doing right now, your close rate will probably double with that close. Did with them.
Last
Yeah.
question, I promise. One of the
Dude,
questions I
keep
get
going.
From almost everybody is, okay, I want to do this. How long is this going to last me?
Yeah, so I actually got this from an orthopedic surgeon that I was working with and doing this. He's like, Scott, most people that I say, like if they're looking at knee surgery, and I say, this will buy you 2 years, okay, let's do it. So what I tell people is, look, for some people, like I have people that did it 7 years ago that still have no pain. But not everyone's like that. But most people, if they're trying to not get a surgery or whatever, would it make sense if you could push this thing out like 2 to 3 years at least? And then maybe you do another injection and you can avoid it altogether. But for the most part, you know, most people are getting 2 to 3 years plus out of an injection. Yeah. So that's what he said to all his patients, is like, if you could push it out 2 to 3 years, would that be worth it to you? Yeah. I don't want to do a surgery right now. And they would jump right on board. I'm like, that's great. Yeah, I like that. So Yes.
advanced care card, and they charge you 0%. It's a Discover card that people apply for, but it's specifically for medical services. So they have a higher acceptance rate. And the only thing that you're going to pay is whatever fee you pay to use your credit card.
Yeah, and you're doing like $12,000 to $15,000 cases with that, right? Yeah.
AdvancedCareCard.com.
Yep. This is why I love everyone together. It's like, yes, thank you, thank you, thank you. A lot of good stuff. All right, that is it. Any other questions on the presentation and the close? Does that seem helpful to you guys?
I had one
Brian.
question when you're talking about the stem cells, and you didn't cover this, the last thing, it says 2 to 3%. Going through the how they test them, how they do, and the type of cells and all that, it says that very specific to 2 to 3%. They only allow like 2 to 3% to donate. Is that what that?
Oh, yeah. When the mother is screened, only 2 to 3% of them actually qualify to be able to donate a cord.
Okay. Thank you.
Yeah. Yep. It's very selective. Yep. So one of the things that my mentor always tells me is he's like, Scott, I don't care if you think it's right or wrong, but I am right, so you just need to do it. And so he's like, your success is going to be dependent on your compliance, because he's done well in his life. He's built 18 amazing businesses. And so I'm like, okay. And I will just tell you guys, I don't care if you like that close. I don't care if it feels good to you. Do it. Do it. Your family will thank you. Your bank account will thank you. No, it's good. So just use it. And I mean, so many docs that I've trained have, I don't like this line. I don't like that line. I'm sorry, when I saw Dan Kennedy do that close, so Dan Kennedy used to go to, those big, they used to do those big Zig Ziglar, stadium tours and all that kind of stuff. And they would have a politician, like Colin Powell or something like that. And they would be the last big speaker of the night. And then they would bring Dan up after them. And everyone's literally standing up and walking out because they saw who they came to see. Dan had to get people to sit their butts back down in the seat, do a 1-hour presentation, and sell them to go to the back of the room. He was the #1 seller at all those big conferences. Last guy when everyone was trying to get to leave. That's why I listened to his close, and that's why I copied it word for word. I'm not messing with it. So I would suggest the same for everybody. So good stuff. Let's take a break, and then Ed,
Yeah,
what do you?
let's just for time's sake, it's 3:22. We'll come back at 3:35, and we'll be rocking and rolling.
Okay, sounds good.
What time are we going to?
5. Yep, we'll have an hour and a half left.
All right.
Yep.
Yeah.